Well, joining me now is Dr Layla McCay, who's the Director for the NHS Confederation. I'm presuming that you welcome this announcement from the Health Secretary?
Yes, absolutely. I think that when we think about the people who are vulnerable to becoming infected, there's so much talk about the healthcare workers within the NHS, but actually we have this huge care system with these people who absolutely need this, and it's really positive to hear that finally their voices are being heard.
You use the word finally. There will be a lot of frustration that this is only happening now.
I think that's right. I think, as we've all heard, there have been various challenges in scaling up testing, and it was only quite recently that we've started to have testing available for all NHS staff. It's something that the members of NHS Confederation have been calling for since the start, and now we're able to see that being rolled out both to the NHS and beyond to everyone else who's working with these patients.
What it has done is it's very much put the care workers on the front line in this crisis, a place perhaps they didn't feel they were at the beginning. And if there's any good to come out of this, it is we do now appreciate more than we should perhaps what they've been doing.
I think that's right. I mean, if you're interested in healthcare, you also have to be interested in social care, because those are two incredibly interconnected worlds, and what happens in one affects the other and vice versa. So it's incredibly important that we look at this in a joined up way to make sure that we're delivering the right response for patients all the way across the board.
This is at the moment a pledge, a promise from the government. What do you need to see happening now?
I think that we need to hear the detail of this. Already we know that while the government has told us there's now testing available for everyone in the NHS and their families with symptoms, actually what we're hearing is that many people do not yet have access to that testing. It's still at a reasonably low level, particularly primary care and others are really struggling to access that. So I think that what we're going to see both is the detail of how this is going to be scaled up in the NHS, but also now that we're expanding out here, how they're going to scale this up to make sure that care providers and patients in care settings who need these tests are able to access them.
And do you think we now know and have a clearer picture of what's going on in care homes?
I think that the latest figures from the Office for National Statistics have really helped to illuminate a wider picture than we had before. We've been receiving the daily figures about deaths from people who had COVID-19, and that has very much focused for England and Wales on deaths in hospital. And it's been a little bit more of a mystery as to what's happening outside in the rest of the world, and we've been looking out to the rest of the country and thinking, goodness, actually, what's going on here? Now we're starting to see these figures coming in, and just as we thought, there are significant numbers of deaths out there in the community, and if we're going to understand COVID-19, how it spreads, how to manage it, we need to look at this full picture.
The NHS Confederation, which you represent, that's the body that brings together, speaks on behalf of organisations that plan, commission and provide services in England, Northern Ireland and Wales. I'm just wondering what sort of stories you've been hearing from members about the difficulties they've faced since this outbreak began.
I think that there are lots of different issues that our members bring to us. Probably the availability of PPE, personal protective equipment, is one of the biggest and most persistent challenges. While some people are now able to access it, others still struggle to get the PPE that they need, particularly those who are out of the acute hospital settings, but even those in acute hospital settings. And that is an ongoing challenge that I know people are working incredibly hard on, and they need to keep doing that because this challenge has to be solved. There's also a lot of interest in staff wellbeing all the way across the system. Everybody who works in care, in healthcare, whether that be a doctor, whether it be a porter, this is affecting people in all sorts of ways. They're seeing a great deal of challenge, a great deal of death, perhaps even the death of their colleagues in some cases, and this can have a real impact. So our members are really interested in that as a challenge as well. Well, I think that also there's an increasing interest in various other things about who's being affected more than others, and are there different issues around that as well.
Well, I suspect we'll be talking about it again, I'm sure. Dr Layla McCay or McCay?
It's McCay.
McCay, I above anybody should know how to pronounce these names, but there we are. It's really good to talk to you. Thank you very much for your time.